This video is going to be about the arteries of the pelvis using a model. First, we're going to look at the diagram in Grant's dissector. Here's the common iliac artery, branches into external iliac and internal iliac. So we're going to look at the branches of the internal iliac. Some of them are called visceral branches and some of them are called parietal branches. Many of them will stay within the pelvic cavity and others will leave the pelvic cavity. So we're going to start with the superior and inferior gluteal and the internal pudendal. This is the superior gluteal artery. It's going to exit the greater sciatic foramen superior to the piriformis to supply the gluteal region. And notice its position between the lumbosacral trunk and the VPR of S1. This is the inferior gluteal artery. It's going to exit the pelvis through the greater sciatic foramen inferior to the piriformis. And notice its position between the VPR of S2 and the VPR of S3. That's the typical position. And then this is the internal pudendal artery. That's going to exit the pelvic cavity through the greater sciatic foramen inferior to the piriformis, and it's going to travel with the pudendal nerve to the perineum. Let's go to the model. This is the common iliac artery, This is external iliac and internal iliac. This is the superior gluteal artery. It's passing out of the pelvic cavity superior to the piriformis. This is the piriformis muscle. It forms the bed for the sacral plexus. This is the lumbosacral trunk, and this is the S1 ventral primary rami. So like the picture, the superior gluteal artery is passing between those. This is the inferior gluteal artery. This is the piriformis, remember. This is S1, S2, and S3 VPR. So the inferior gluteal is made to be passing between S2 and S3 VPR. This is the internal pudendal artery, and it's going to exit the pelvis inferior to the piriformis and go to the perineum. Another artery that's on this model is the obturator artery. That's easy to see. It's going to be traveling along the lateral wall of the pelvic cavity. This is the obturator internus that is on the anterior and lateral wall of the pelvic cavity. And this is the obturator nerve, and the obturator nerve and artery and veins will go through the obturator canal right here. Many times the obturator artery does not branch off the internal iliac. Instead, it branches off the external iliac, and it will pass superiorly to the superior pubic ramus right here and go to the obturator canal. Hope that was helpful.